After the tragedy of Typhoon Haiyan, locally known as Yolanda, Tacloban's resilient people are determined to rise from the rubble and build back a city that is more vibrant than ever. So 1 month after the storm, with the invaluable assistance of UN Habitat and experts from a wide range of disciplines, the city began crafting a master plan for recovery and rehabilitation, a roadmap to ensure that all steps taken during the emergency and recovery phases will also be building blocks for long-term development. The master plan addresses 6 key result areas: shelter for the internally displaced, restoring and strengthening educational and health services, rehabilitation of damaged infrastructure, revitalization of businesses and livelihood, rehabilitating damaged natural resources and buffer zones, and institutionalizing the learnings from the Haiyan experience to become better prepared for future emergencies. The most urgently needed housing assistance was for 14,500 families in areas that have been tagged as unsafe. The target is to move as many people as possible out of unsafe areas to resilient housing in safer areas. In the long run, it is more sustainable and practical to have as few people as possible to evacuate in times of emergency. Areas mapped as safe in northern Tacloban were identified as the best location for new mass housing projects. The vision for Building Back Better is not just a relocation site, but a brand new township in Tacloban North, complete with schools, health facilities, public safety services, commercial areas, parks, and even a satellite office of the City Hall. Tacloban North is now being master planned to become a highly desirable place to live and do business. It has the advantage of higher altitude, plus prime locations with breathtaking views of San Juanico Strait and the mountains. The current challenge in Tacloban North is a sustainable, cost-effective water supply and delivery system. This problem hampers the relocation of families still living in unsafe areas. All of the city's 7 hospitals and 17 village health centers sustained major structural and equipment damage from Typhoon Haiyan. But thanks to the cluster approach, basic health services were restored and augmented by 8 organizations within several days after the storm. This went a long way toward reducing anxiety among the people. Today, our health facilities have been restored thanks to numerous development partners. But we seek not just to rehabilitate damaged infrastructure, but to strengthen systems that can ensure long-term health and happiness in our communities. Our strategy includes strengthening referral pathways, training community health teams, and empowering each household by putting their health in their own hands. The city is subdivided into districts, and each district is further subdivided into 8 or so villages. Each district has its own health facility, manned by a doctor and nurses, and functions to deliver primary health care and as a birthing center. Each village has a small health facility manned by a midwife and village health workers, providing basic health services such as the monitoring of pregnant women, immunization, and treatment of common diseases. This catchment system was designed so the people will know where to go for their health needs and to which facility they will be referred to in case they need a higher level of care. If there are cases beyond the capability of Tacloban, hospitals in other cities will receive our clients. This system becomes especially important in the case of another calamity. Training community health teams, which consist of volunteer workers, is necessary to improve health service delivery, until ordinances are passed to increase personal services, currently limited by laws that are several decades old. Finally, we seek to educate and empower the community to not be doctor-dependent. Each household is provided with their own basic health kit, which includes basic medicines such as pain relievers and antidiarrheals. We also aim to strengthen environmental health and sanitation, since 80% of diseases are preventable by the simple practice of hand washing. Typhoon Haiyan brought about one of the most massive humanitarian crises the Philippines has ever faced, but it showed us that the world can come together in dynamic collaboration to see a devastated city rise from the rubble, build back better for the children, the future of Tacloban City.